Good morning. This is Dr. Living Well, and we're going to chat. We're going to chat today about something that could literally cause someone to potentially pass away. Yes, you heard me correctly, to die during any type of exertional event, even sexual intimacy. In fact, the reason I make this video is because I was reading recently about a case of a young lady who passed away from a hemorrhage in the brain that started during sexual intercourse. And there aren't many things in our business, in the medical profession, and I am a physician, a family practitioner. There aren't many things that make us nervous, but one of those things that does make us nervous is a thunderclap headache. And the reason they use the term thunderclap, and this is an article from the Mayo Clinic where I trained, the reason they use the term thunderclap is because the headache will be probably one of the worst headaches you have ever had. It will be abrupt and it will come on aggressively, and people can barely tolerate the pain. And typically, these headaches will occur during an event that is exertional, like sexual intimacy or working out at a gym or running or doing something on a treadmill. And when these types of headaches occur, it is an emergency. It's a 911 event. It is get medical help as fast as you can. And thunderclap headaches get their name from the fact that they occur suddenly. It's like a clap of thunder, and the pain will be severe and it peaks within 60 seconds. They are very uncommon. In fact, in my career, I've only had a few patients with them, but they have to be taken seriously because they can warn of a potentially life threatening event. And these headaches can go away if they're occurring from like an aneurysm. An aneurysm would be an enlargement in an artery of the brain. And when an aneurysm occurs, the artery will balloon out during the stressful event, if that event is sex or if it's exercise. And then when you relax, the artery can shrink back down and it will decrease pressure within the brain and the pain can subside. So if you ever get a headache during any type of physical activity, and that headache is severe, even if it goes away, you need to see a physician. You need to get medical advice and evaluation as soon as possible. Now, my videos are for educational purposes only. I'm not giving you medical advice. This is just to teach and it's just for learning purposes. If you have a medical issue, you should see a primary care physician, go to the ER, or seek the attention of a specialist. But when you get a thunderclap headache, if you look right here, Mayo Clinic and many experts will tell you you need to seek medical attention right away for any headache that comes on suddenly and severely. There are other causes besides brain aneurysms. You can get bleeding into the brain. That's what happened with this poor young lady that did ultimately pass away. If you look here, this article isn't terribly old. It's from 2015, and it talks about how her headache started during sex, how her medical evaluation showed a bleed into the brain, and how she ultimately succumbed to her illness. Now, we feel for her and her family, but we are going to use this event to get the word out to people that if you get any type of headache during any stressful event, it needs evaluation, okay? So causes for this type of thing, you can have a bleed into the brain or around the membranes covering the brain. You can get a rupture of a blood vessel in the brain. You can get a tear in the lining of an artery within the brain. Leaking of cerebrospinal fluid can also present with a terrible headache. Death of tissue or bleeding in the pituitary gland can cause similar symptoms. Blood clots in the brain, severe elevation of blood pressure, a hypertensive crisis can also cause that type of headache. Infections such as meningitis or encephalitis, and of course, an ischemic stroke. Now, there are other things that can cause this, okay, and we didn't list them all here. The bottom line is, if you get a headache that occurs during exertion, whether it be sexual intimacy, running, lifting weights, etc., if you get headaches during those types of activity, you need to be evaluated. It's just that simple. So that's it for today, folks. Again, Dr. Living Well. Please follow my channel. I'm going to bring you good information as frequently as I can. God bless. Have a good day, and thanks for listening. Bye.